This is Neevita Narayan, Audiologist, Speech and Language Therapist at Sphere Speech and Hearing Clinic. We are located in Delhi, Noida, Gurgaon and Patna. We specialize mostly in dealing with hearing loss in children and adults, especially babies. I've been talking about in the past few talks with Lazoi on hearing loss, how to diagnose them and what are the treatment modalities. Today I'm going to talk about a treatment, a final treatment for hearing loss when anything does not work or hearing aid does not work. What is it? It's cochlear implant. And now in this talk we will learn what cochlear implant is. Cochlear implant is a treatment for deafness in children and adults. What happens when the child or adult is deaf? So our ears are divided into three portions: outer ear, middle ear and inner ear. When the hearing loss is because of the problem or damage in the inner ear, or we technically call it cochlear, then the cells of the cochlea are completely damaged. It is so much damaged that even the best and the most powerful hearing aid is not adequate to give the right hearing or audition to the child or adult. Now, what happens if we fit a hearing aid to such children and adult who has substantial or more than 80% of hearing loss? It does give amplification. The hearing aid does give amplification and restore some portion of the hearing, but it is not able to restore 100% hearing. And in children, when 100% of hearing is not restored, what happens? They are not able to develop normal speech and language. And in adults, there are still situations left when they are unable to cope up in group conversation, hearing in noise, and there are lots of such challenging listening situations where adults are not able to cope up with their hearing aid. You will commonly find adults wearing a hearing aid or complaining about hearing aid, that hearing aids are not giving them full benefit. I sincerely request such patients or adults to come to us and seek for advice on cochlear implants. There is no harm exploring out new technology, new treatment and new solutions. Cochlear implant has two components. There is an internal component which looks like this. This is a device or an implant that is implanted by a cochlear implant surgeon in the cochlea. And what is cochlea? Cochlea is the inner ear. Now this surgery is not a complicated surgery. It is not a brain surgery. It's a ear surgery, but it requires precision. So a very trained surgeon is required to do this cochlear implant. We are attached with Apollo Hospital, New Delhi, and other branches of Apollo Hospital to support cochlear implant program. We are one of the pioneers in the country, and our program has successful cochlear implant outcomes. So cochlear implant not only has internal component, it also has external component, which looks like almost like a hearing aid. Now this external component after the surgery is fitted by an audiologist, which is fitted externally. So the internal component and external component has to work together to make a cochlear implant function. So this is how it works together. So what is the process of getting a cochlear implant? A cochlear implant, first, any patient, any child or adult has to be evaluated whether he or she is a candidate for cochlear implant. And how do we evaluate? An audiologist is the professional who does this job. We have to check how much he or she, child or adult, is getting benefit from hearing aid by doing various tests along with hearing aid to establish the benefit from hearing aid. If the child or adult is not getting adequate benefit from hearing aid, then we start the process of cochlear implant. So after doing the audiological evaluation, we also have to take these children and adults for radiological evaluation. It is done by radiologist. We have to see whether the inner ear structure and the nerves are all right or not, if there is any abnormality. Not that the abnormal cochlea or abnormal nerve cannot get an implant, but we need to know well in advance before the surgery whether inner ear structures are normal or not. So once we establish that, once we establish the audiological evaluation, then we start the process of cochlear implant. In a cochlear implant process, before the surgery, there's a huge component of making the family understand the entire process. That is counseling. We spend tremendous amount of time explaining them because it is an expensive and time consuming treatment. Then comes the surgical part. The surgical component is done by a cochlear implant surgeon, and as I have already told you, we are attached with Apollo Hospital for the cochlear implant program. We are handling Indraprastha Apollo Hospital's cochlear implant program. After the surgery, the patient, that is child or adult, comes back to the clinic and we do the switch on. In switch on, we fit the external component. That is the time when a deaf child or an adult hears for the first time. That's a very emotional moment for the entire family. Many a times they break down. I have been a part and process such emotional moment, and believe me, it's an exciting journey to take the family through from the silence to the hearing world. That is the first time they hear the sound, and that is why we name it switch on. So they are switched on to the hearing world, and that's not the end. That's just the beginning, and that is the time mapping is required. We have to tune the external processor several times so that the hearing becomes better and better and better and better. There are challenges in it. Audiologist has to be trained in handling the device. And then after the mapping or along with mapping comes the treatment of speech and language therapy. So cochlear implant is a process. It is just not one surgery. The entire treatment is a process wherein we require a surgical team, we require audiological team, we require a habilitation team. I'm Neevita Narayan, audiologist at Sphere Speech and Hearing Clinic based at Lajpat Nagar, Delhi, Noida, Gurgaon and Patna. If you want to get back to me on cochlear implants or anything, any query related to cochlear implant treatment for child or adult, please get back to me through lazoi.com. Thank you.